Seattle Public Health addressed the continuing problem of drug overdoses and deaths in the city and King County as a whole, claiming that racism is one of the reasons for the crisis. Does this make any sense at all? And like I was saying earlier, but you couldn't hear me, vast majority of people in Portland, vast majority of people in Seattle, you go to these homeless encampments, they're white. Vast majority of people dying of drug overdoses in the United States, white people. White people, not any other races. And we'll take a look here at a little bit at the King County statistics, the overdose data. They've got charts. And it's just so clearly, okay, yeah, these numbers are going up, but this is an equal opportunity deal. People of all races are dying from this. It's not just, let's just hit the white people. The finger pointing was part of a statement that acknowledged that from 2021 to 2022, there was a 40% increase in overdose deaths, with fentanyl being a key culprit. 107,000 people in the United States last year died of drug overdoses, right? 107,000. Do we hit 200,000 this year? I bet you we do. I've talked about this a bunch. I bet you we do. And when you start to get to those numbers, city, county, state, and federal officials, they're going to start doing the finger pointing. All right, it's because of this. You guys on the addiction services, you guys aren't helping out. It's because there's not, lack of affordable housing. They're going to come up with all kinds of stuff to blaming this on. But racism, systemic racism, this isn't one of them. The finger pointing was part of a statement that acknowledged that from 2021, 40% increase. Here's the statement. The underlying root causes that have resulted in the current overdose crisis are, unfortunately, not ones that will be reversed overnight, Seattle Public Health Communications Specialist Sharon Bogan said in a statement to local KIRO 7. Okay, that is what I have been saying, because the mechanics we'd have to put in place to stop these overdoses, we're not willing to do. We're not willing to involuntarily put people into treatment. We're not willing to, involuntarily put people into mental institutions. And so much of the drug addiction that's going on right now, it's drugs that are creating almost like a psychotic break in people. So they can't make this discernment of, you know what? I need help. I need to go get some treatment. It's just not happening. So structural factors. Okay, here it is. Structural factors, including lack of economic opportunities. All right. Well, your vast majority of these overdoses, white people. So, where are we going there? And then I lead it directly into, if you are on drugs, your economic opportunities are going to go out the window. But we're talking about the causes, right? But no, you're right. If you're going down the road of drug addiction, you're not going to be able to hold a job. You're not going to have any economic opportunities. And that's going to lead to everything else going sideways for you too, right? Social isolation. All right. So, maybe during the pandemic we had that, but we've been out of the social isolation for so long. This one doesn't make any sense. I mean, what's social isolation? What? You're going and doing drugs by yourself. Vast majority of the folks that we're seeing overdose, they're in social situations. They're not just one off in, somewhere else. But, maybe we're talking about people who are just socially isolating themselves. Now, sometime, but this isn't a systemic, cause. Structural racism. Again, I go with, since we're at that point, let's just jump over to the 2022 overdose death reports. Got to remember where I was. All right. So here want to make sure you guys can see this. Here in this kind of peach colored, those are white people. Those are white people ODing from drugs. Okay. And here's 2012. And then we start to ramp up, and we're really starting to ramp up here. All right. The blue is black people. So are those numbers going up? Yes. But also numbers for white people are going up. And you can see the vast majority of this, especially up in here, the vast majority are white people. Black people comprise a very small percentage. But then again, you've got I think the black population in King County is like 6.7%. So is this blue portion here overrepresented? Probably, but not by enough where you can say, hey, this is systemic racism. And then, okay, let's get into the other ones. Green is Hispanic. That's probably about half of the black population. Okay. And then we have got, AIAN. I don't even know what that is, whatever that is. Asian is yellow, and you can see those have been very consistent. Okay. Some happening there, and then multiple races is black, black colored here, but vast majority white people. So, all right. Okay. I mean, this to me is a stretch. This is one of those things where, systemic racism is the catch-all for everything that is bad with society today. But unfortunately, I don't think you can pin this one on the overdose that are happening. And what I was going to say earlier is Dave Chappelle has a bit where he goes, poor whites love their heroin. And you know what? After thinking about that, I'm like, oh, that's a little harsh. It's totally true. And another part of his bit is, I'm having the same feelings towards white people that white people had towards black people during the crack epidemic. I simply don't care. And he was just being brutally honest. He was like, that's happening to other people. It's kind of like that's their problem. And I think the vast majority of white people, when the crack epidemic happened, you're kind of like, what is going on there? What is the deal there? That's some craziness. But now that it's happening to the white population, as we just saw from those numbers, in much greater percentages than, any other race, multiple times more, it's like all of a sudden it's a big health crisis, right? I mean, that's just kind of, this is, the overdose situation is to the point where nobody can avoid it. I did something yesterday. I posted this is a free box of Narcan. I got 2 of these bad boys because I just wanted to see what the process was from a company in Seattle. I saw a link in one of my podcasts and I thought, I'll just talk about that for a second. And, so I filled in there was a link in a podcast. I filled in my information and they said, due to the, overwhelming, demand for free samples of Narcan, it may take months for you to get them. And it came in about, I'm thinking like 10 days or something. So there are 2 4 millimeter or 4 milligram, not millimeter. Millimeter is a measure of distance, milligram measure of, whatever this is. So, you just take it out and squirt it up somebody's nose, 4 milligrams, and hopefully they come back. But, this is becoming so prevalent that I went ahead and posted on my Instagram yesterday, hey, got my free sample of Narcan. And so many people reached out on that. They're like, where'd you get that? How'd you get that? And other people are like, yeah, I use that, in my street outreach was one of my Instagram people that follows me on there or friends or whatever it is. So it's become just this crazy thing where having Narcan is, I'm just going to throw one in my gym bag. I'm going to throw one in my car. And I am not in favor of having this everywhere because this is kind of one of those admissions of, well, it's gotten so bad. We might as well just get Narcan, everywhere we can. And we're just going to roll with this. And it's okay. If you overdose, we're going to Narcan you up and away we go. So, I had mixed feelings about doing this, but I wanted to be able to go through that little drill and say, hey, you can get it. It's free. But that's part of the problem with a county like King County, where I am in, and in Seattle. That's part of the problem is people have in the back of their heads, well, if I overdose, there's probably some joker walking around here. Maybe there's some ridiculous podcaster on YouTube that's got a little bit of Narcan. And you know what? They'd be right. I am literally proving them right that Seattle is a place where, you can go and do your drugs and overdose, and odds are much higher here than anywhere else. Because I bet, so many of you living in other places, maybe the Midwest, where this overdose thing isn't a big deal. You don't have Narcan being mailed to you for free by some pharmacy over in Seattle. It's not a thing. And people, you don't need it. But here in Seattle, it's like, okay, this is kind of where we're at. But blaming structural racism, I'd like to see the lead up to that. Or how do we get there? So we got structural racism. These are the structural factors. The next one is criminalization of substance use disorders. I don't think substance use disorders have been criminalized, but the decriminalization of drugs certainly hasn't helped out, right? Because you've created this society that has said, all right, you got a bunch of drugs on you. That's okay. You go out and commit crimes to feed your drug addiction. That's okay too, because we're not really going to prosecute you. We're not really going to, do much to you. And, our minimum sentencing, who needs that? And then you defund the police, don't have enough police to run around and do their thing. So all of this stuff is contributing to an ecosystem that is just wildly off the rails. And, I wouldn't be surprised if the numbers start to get really monkeyed with as far as, you remember when we used to talk about COVID, somebody has a heart attack and dies and, check that one off to COVID. I'm kind of joking, but I'm kind of not. When are we going to start seeing that? All right. That wasn't fentanyl. That was, we're going to call that one heroin, because the numbers are starting to become, when you've got a tenth of the percentage of, or 10% of the number of COVID deaths that you have now in overdoses. Yeah, those numbers you can't avoid. So now we've got this finger pointing. Well, let's blame it on systemic racism, because then, you can point that, and who's going to fix that? We've got housing stability. Housing stability is being blamed for this. I call nonsense on that. That is nonsense. Now, when you do have housing stability issues is when you're on drugs and you don't have a job, going back to the economic opportunities, there's a double whammy right there, right? So they're pointing out some really good, aspects of this overdose epidemic we're experiencing, but not as the causes of what's really going on. So housing stability. So rent got too expensive, and so you do drugs. Okay, housing stability, you're losing your home. Well, not everybody goes to drugs and, lives a lifestyle in the streets. In King County, what we are seeing is people coming here from all over the country because people know that they can go to San Francisco. People know that they can go to Portland. People know that they can go to Seattle. Those are hubs. Those are major West Coast hubs for all of this stuff, because we've made an ecosystem out of it that basically says, come to us. We'll help you out. We'll help you out. No issues there. If you overdose, we're going to help you out. I mean, San Francisco just closed down in the Tenderloin district, I think it was the Tenderloin district, a massive, clean shoot up area. And of the thousands and thousands, I think, was it 23,000 people, something like that? I think 18 went into rehab, 18 contacted services. So people don't want to get off this stuff. They want to go to an area where they can do this, live in an environment that's going to make it easy for them to do it, get fed. And speaking of being fed, remember that video I showed you of Wendy? She was the homeless person down in Portland. And she just basically started babbling about, this is the greatest place ever. They make it so easy to be homeless here. And she was on, whatever drug she was on. She had lost her dentures, if you remember that story. Well, that tweet went viral. I think that had like 7 or 8 million views the last time I saw it. And that actual video. And then her family came out from Utah, and she had a bunch of siblings, I think 9 siblings. So they came to Portland and they showed the reunion, and I don't know if she's going to leave. I don't know if she's going to get help, but, she basically broke it down, and she, didn't get in trouble, but she kind of retracted, you know what? It's not as easy as I was saying. And she wanted to I'm sure some people got to her and said, hey, it would be nice if you said that it wasn't quite as easy as you're making it out to be in Portland. And part of that was she was naming a place that she could go to and get food. You go over to the whatever it was. You eat and you go get high. You eat lunch, go get high. You eat dinner, go get high. She was basically breaking it down, and that went viral, and everybody was like, okay, all right, there you go. And stigma. Stigma is the last structural factor here. Okay, and what comes to mind there is drugs are bad, right? From South Park, drugs are bad. Yeah. So you've got the stigma of drugs are bad. Being on drugs is bad. Okay. But that's because all of this other stuff ruins your life. There should be a stigma against this. It shouldn't be, hey, it's good to do drugs. Go out and go do your fair share of fentanyl. You got to drop the hammer on this stuff, or you just let it rip the way we're doing. And so many of you say, hey, it's taken care of itself. It is a self-fulfilling, survival of the fittest. And if enough druggies take fentanyl and overdose, well, that's the system kind of righting itself. And where that breaks down is, what if that's your kid? What if that's your parent? What if that's your grandparent? Whatever it is. Vast majority of these overdoses happen sometime before age 50, right? What if that's your nephew? What if that's your grandson, granddaughter? That's where it kind of breaks down, where people are like, yeah, there's that. So, and that's where I kind of go to that. All right. So if you could save a life with one of these bad boys and you didn't have the Narcan on you, all right. Yeah. Would you have it stuck in the back of your head? Maybe I could have done something. But then the flip side to that, and the reasonable side to that, is we shouldn't have to be doing this nonsense, right? I mean, when I watched Pulp Fiction back in the day, and Eric Stoltz took that needle and jabbed it into, was it Uma Thurman? I think it was Uma Thurman, and she just popped up. You had heard about that kind of stuff, right? That was the adrenaline needle. You had heard about that kind of stuff, but overdoses happen to, those heroin people. Now they're happening all day long because this fentanyl that they've got and the meth that they've got are so strong that, a couple of milligrams will just take you out, put you in the dirt box nap, right? So in summary here, lack of economic opportunities. No, people are making choices to do these drugs. Social isolation. Okay. Maybe there's some data on that there somewhere. Structural racism. I'm going to have to say no. Criminalization of substance use disorders. All right. Maybe you got some data on that, but the way I see that is it's the drugs killing people and people making choices. How about not blaming their addictions? How about blaming their choices? And they've got the choice to, get themselves into rehab. They can make that choice. Do I use today? Do I not use today? Where that breaks down is these drugs that we've got going here. And the reason they're killing so many people is because they're so strong, and because people, when they get hooked on them, unless they've got a real strong family structure, you don't have anybody in your camp to say, hey, you need to get off this crap, because it takes a lot of dropping the hammer to get somebody off of this stuff. Like to the point where other people in your family, other friends and family are going to say, hey, you just need to let that one go. All right. And you let that one go and they die. Okay. So, it's all part of the big picture, right? So we've got the housing stability. Yeah. And stigma. All right. Yeah. Drugs are bad. Addiction is bad. It's horrible. It's not good to die from an overdose. Those are some things that come to mind when I read this. And those are just some of the factors that will require long-term systemic changes and resources at all levels, from federal to state to local. This is where I do agree with this statement, because it's not a housing issue in the homeless encampments. It's a drug issue. It's a drug issue, but everybody wants to say, well, because of income inequality and you got rising housing prices. Most of the people in the homeless encampments aren't from Seattle. Most of the people in Portland are not from Portland. They're from all over the United States, and they float between cities. I did a podcast the other day on a kid that overdosed, and he was on his way up to Alaska, stopped in Seattle for 3 days, never got to Alaska, and his parents are just, they're heartbroken. And that's where, this stuff happens. And we don't have the state. We don't have the county. We don't have the local, the federal. We don't have any of the support systems to start putting dozens and dozens and dozens of people into rehab. We don't have that. And the insurance system is so brutal to get somebody in. If you've got Mac Daddy insurance, which most drug addicts do not, because of that whole don't have a job thing, it's, virtually impossible to get into treatment center. You can get into state centers, but they make it hard because they've got so many people that are coming in from the prison system. They're coming in from wherever to get in there. Yeah, we don't have the social services to deal with this. So I do agree with the fact that, we're playing whack-a-mole with the people out in the homeless encampments, and we're just, moving them around. But bottom line is, until you get some of these folks into treatment, your numbers really aren't going to come down. The statement came amid the revelation that the Seattle Fire Department has dealt with a staggering rise in overdoses in the past year. You look at the number on how many responses they're doing. I talk with police officers, say the same thing. Went out on 5, overdoses today. And you know what? What was really interesting? One exchange I had was 60%. This is a hard fact. No, we're totally guessing. 6 out of 10 addicts, when they wake up from an overdose, you know what they say? What do you think they say? I didn't do any drugs. I don't do drugs. I've never done drugs. And yet they've just woken up because some cop or some fireman gave them a dose of this. It's like, all right, so I just gave you a little spray there, the Narcan, and you popped right up and you're here with us, but you're denying that you're on drugs. Well, that's what you do, right? Just completely deny the whole situation. Then they also wake up very agitated and wake up, swinging because they're just all, it's not going the way they thought it would go. What happened? What am I doing? So, these are not great calls for Seattle Fire Department, Seattle Police Department, Portland Fire, any of these entities to be going out on. And then the statistics are becoming so great now that you can't avoid it. So, let's blame housing opportunities. So on a daily basis, Seattle firefighter EMTs and paramedics respond to suspected overdoses across the city in our unhoused and housed population. Fire department tweeted on Monday. Over the past 12 months, Seattle Fire Department has responded to more than 5,200 patients with suspected overdoses, compared to 3,600 incidences the year prior. So that is spiking, and the number of people dying from overdoses is spiking as well. So, Seattle Fire Department goes on to tweet, most of us know someone who personally has struggled with drug addiction on a daily basis. Seattle firefighters, they go out and they try and deal with this. One of the other things that I've been following is that we're basically using police and firemen in place of social workers because, they should be out, working on, actual crimes, right? And because their bandwidth is so minimal, they're not able to when they're doing all this other stuff. So if you wonder why, you're not able to get, if you're a business owner in Portland, business owner in Seattle, and you wonder, why isn't anybody coming by today? Well, they're trying to revive that guy who just overdosed. Yeah, that's literally what we're talking about. So you've only got bandwidth for so much. And overdoses are a priority call. We had a police officer in Seattle, run somebody over, trying to get to somebody, trying to save somebody's life. Accidents happen. That's horrible. You think that cop did it on purpose? I'm going to run this guy over here, this gal over here, so that I can go save this other person's life. No, that's, totally unreasonable. Totally unreasonable. And yet the person that got killed at the intersection in Seattle is now one of those people that, because it happened by accident from a police officer, they're being, made out to be a saint, just like the tree hugger down in Atlanta, in Cop City, who shot at a cop and then was, returned fire, killed him. That person is now a saint in, activist groups. And it's like, the cop running over somebody is an accident. That happens. Stuff happens. I'm surprised it doesn't happen more often with how much, just running around, cops are doing. And it's just, it's wild stuff, right? And it's not going away is the bottom line. It's not going away, because what's it going to take to get these people off the drugs? What's it going to take to get them off of the streets? It's going to take some pretty hardcore rehab. It's going to take some pretty hardcore getting into mental health care facilities, because a lot of these people, these drugs are so strong, it breaks them. I don't know if they can come back. I don't know if we have the data on, all right, here's what the super meth now is doing to an individual. And do we have the long-term studies? No, we don't, of what it does to somebody's mental state. The Washington Supreme Court effectively decriminalized drug possession in the state in 2021 when it ruled that the existing statute making it unlawful was unconstitutional. The decision came in a case of a woman who was arrested on suspicion of an unrelated offense, and when she was searched, cops allegedly found cocaine in her pants pocket. She claimed she had borrowed the jeans from a friend, but was convicted nonetheless. This is what we're dealing with in Washington. No, that's not my stash. Well, that's your car. I know. And it's your backpack. I know. Somebody must have put it there. These are my friend's jeans. Who borrows pants from their friends? Do you borrow clothes I can understand maybe a sweatshirt when it's cold outside and you went over to somebody's house, something along those lines, but pair of pants. And if you borrow somebody's pants, do you check the pockets? Oh, hey, got a little cocaine in here. Extra bonus today. It's so ridiculous. So ridiculous. You borrowed those pants. Somebody left coke in your pocket. Oh my gosh, we need to change the laws for this. We need to decriminalize this stuff because, war on drugs didn't work and we're going to make this so much better. Yeah. Hasn't really worked that way, has it? So you've got all these direct things you can point at. Systemic racism, in my opinion, isn't one of them. So the state Supreme Court overturned it because the law did not require a defendant to know that they possessed drugs. I didn't know. I had no idea. Come on. I mean, it's kind of like the overdose victim popping up and said, what drugs? What drugs? There was no drugs. There was no drugs. How about those bears? How about those bears? It's from another podcast. Yeah. You get the reference, right? It's just in the state of Washington. In other states, they'd say, no, that's on your possession. That's on you. Straight to jail. Go to jail. In Washington state, right? No, we want to give people a break and decriminalize it. And that is how you get to a point where we're blaming this on systemic racism, because what else do you have to blame? You certainly can't blame your own policies. You certainly can't do that. Seattle, Seattle, it's going to have 7 of 9 positions open in the Seattle City Council. 7 of 9. Do you think the residents of Seattle are going to, bring in all Republicans? Are they just going to go hardcore Republican? No. They might go a little bit more moderate. But whoever can spin the best tale on how they're going to solve all this stuff, given the framework that they're working with, they're going to win, right? It's probably not going to be a socialist. Probably not, right? In the meantime, lawmakers are pushing to put a statute on the books for that decriminalizes drug possession. In a conversation with local KNKX public radio, King County prosecuting attorney Lisa Mannion said she believes that those who want to criminalize drug possession really want to stop people from using in public. Okay, this is some nonsense right there. It's not that we want to stop people from using. Well, we do, because that's not okay either, right? But it's the whole ecosystem that this brings. We want to stop people from living in tents out on the street as well. because, criminal activity, we want to stop the violence going on. We want to stop the fires from going on. We want to stop the break-ins of local businesses. That's just become an epidemic as well. Break-ins to fund their next hit, right? That's, some of what we want to stop. We want to stop human fecal matter on the sidewalks because people who do drugs, they don't really care where they go. We want to stop used needles in the parks. That'd be special. That'd be good. We want to stop tinfoil from, clogging up our drains. We want to stop that. So to say that those who want to criminalize drug possession really want to stop people from using in public. No, that is one tiny little bit, but this is, that's silliness. It really is. I really believe what folks want, they want the behavior to stop. And there is nothing magical about a jail cell that cures substance use disorder or addiction, Mannion said. No, that is true. But I can't tell you how many stories that I've read where people have said, you know what? I was physically able to kick the drug addiction, and then it was up to me to make the mental choice. I was physically off of it. I had the choice when I went back out of jail. I can either choose, Avenue A or Avenue B, and that's the mental choice you're able to make. But until you've got the physical part kicked, you're going nowhere. You're going nowhere. So no, maybe jail doesn't cure substance use disorder or addiction. Maybe there are some ways, but we're not putting people in mandatory year-long drug treatments either. We're not even doing much beyond 30 days, and that's all based on insurance. And so, so much of what you read about is somebody went to drug, diversion therapy, and then they got let out. They never showed up. They, got let out and committed another crime. We've just become too lenient. So what are some of the things that we're going to do? Yeah, we're going to have a lot of finger pointing like we got going on here, right? It's blaming these other things. To me, it's just, that's interesting, because you can't look at yourself and go, well, I voted the politicians in who are making this policy. I supported criminalizing drugs, and now I've got to live with those decisions. And now I have to live in a community where this is just par for the course. This is happening. Break-ins are happening daily. All those things we talk about that are part of the addiction process that are happening in real time out in public. It didn't used to be a out in public deal, did it? You'd hear of people overdosing, but they'd overdose in their own house. They'd overdose, in one of those houses where they did a lot of drugs. Now it's just right out in the open. And so much of this stuff is just staring us in the face. And so the residents and the business owners that voted for all this stuff, they're looking for anybody to blame. Why can't the police come faster when they break into our store? Well, because of this, and this. That requires me to take some responsibility. We can't do that. Because then we'd have to look at ourselves and go, we caused this. And everybody in from the outside is looking in going, how many comments do I get on YouTube? You got what you paid for. You voted this in. You got to deal with it. And you know what? It's true. It's absolutely true. There's no way around it. So blaming racism, that's a stretch at best, right? It's a stretch at best based on the data. I'd say the science, but I'm just looking at data.